Hello, this video will show you how to fill out and send your application for the Genetically Handicapped Persons Program, GHPP. This application is intended for both individuals renewing their eligibility or applying to the GHPP program for the very first time. The Genetically Handicapped Persons Program, or GHPP for short, is a healthcare program for adults with specific genetic diseases. GHPP assists those who enroll with their healthcare costs. Applicants accepted into the program may have other forms of health insurance. However, GHPP is the payer of last resort. Before you apply to GHPP, we need to talk about Medi-Cal. Individuals may be enrolled in both Medi-Cal and GHPP, but by law, if you are eligible for Medi-Cal, you must apply for Medi-Cal first. And you will need to provide GHPP proof of application to Medi-Cal before applying for GHPP. If you are eligible for Medi-Cal and haven't applied, then your GHPP enrollment may be denied. Please contact your county Medi-Cal office or visit Covered California to determine if you're Medi-Cal eligible. And for individuals who are not eligible for Medi-Cal, this proof of application isn't needed. You will also need to make certain you medically qualify for the GHPP program. Scroll down to the bottom left of the GHPP webpage and click on the link, Find Out If I Qualify. It will help you see if you qualify for GHPP. There is also a link, Client Questions, for you to learn more about the program. To get the application, click on the How to Apply link, and then click on the link titled Application Part A, Program Eligibility, and Part B, Financial Eligibility. You may choose to complete the application in one of 5 languages: English, Spanish, Chinese, Tagalog, Vietnamese, or Korean. For this video, we will use the English language version to demonstrate. Let's take a look at the application. Part A, or Genetically Handicapped Persons Program Application to Determine Eligibility. We highly recommend filling out the application from your computer, typing in the necessary information and printing later. However, you may still first print and fill out the form by hand if you choose. If you do, please make sure all your handwriting is clear and legible. For the sake of this tutorial, we won't go over how to fill every question and field, but rather focus on the fields we feel you may need most guidance on filling out. The first page, Section A, begins by asking basic questions such as your name, residential address, and doctor's information. You will see some fields are framed in red. These fields are required and must be filled out. Fields without the red frame are optional, though we do recommend filling in these fields as well, especially as they assist our team in providing better customer service to you. And vague or incomplete information might result in inconvenient delays in processing your application. If at any time you have difficulty understanding what information to put into any field, there are a set of instructions beginning on page 5 of the application that breaks down each field question by question. Take a look at Field 4A. Field 4A asks for your home address. This must be the address where you live in California. 5A asks for your mailing address. It is very important to include your mailing address if different than your residential address, as GHPP will be sending all correspondence to the address listed here if different. If your address ever changes, please call and let GHPP know right away. Field 7 asks for your email address. We recognize not everybody uses email, so this field is optional. However, we highly encourage you to add an email address, as it greatly enhances our ability to communicate with you with faster turnaround times, and in turn provide you a convenient way to email our GHPP team should you need help at any time on this application or any other GHPP related issue. Field 13 asks for your GHPP eligible condition. This must be one of the conditions listed under the California Code of Regulations, Title 17, Section 2932. Not all genetic conditions will qualify, so please double check to see if your genetic condition is listed. In Section 15A, you are asked for the name of the specialist who treats your GHPP eligible condition, and to include the NPI number if known. This is typically the doctor at your special care center. Please make sure you write down the full name of this doctor and write clearly. The NPI, or National Provider Identifier Number, helps us identify the exact doctor you've listed. It's helpful to provide if you know it, but not necessary. Field 16 asks you for the name of the Special Care Center, or SCC, that you visit for the treatment related to your genetic condition. It's helpful if you provide the exact name of the hospital that you visit for your special care center. If unsure of the name, you may go to the GHPP website, scroll down to the bottom right where the provider links are, and go to Special Care Centers. On the next page, scroll down to the list of centers and click on the link connected to the type of genetic condition you have. You will then see a list of approved special care centers. If you recognize your SCC, you may list it in field 16. If you do not see your SCC on the approved list, list it anyway, and GHPP may reach out to you regarding what facility or physician to approve for your treatment services. Field 17A asks you for your primary care physician. This should be the doctor who treats you for your regular doctor visits that may be unrelated to directly treating your genetic condition, and sometimes listed as a family doctor or a doctor of internal medicine. Your primary care physician, or PCP, in some cases may be the same doctor who acts as your specialist in field 15A. If so, you may repeat the doctor's name. Your PCP and specialist work together to coordinate your care. So if they ever change, please call GHPP and let our team know. Let's move on to Section B. Section B will be asking for your insurance information, such as if you have Medi-Cal, Medicare, or any other private insurance. You are allowed to have other insurance and still qualify for GHPP. However, all other insurance will be billed before GHPP, and GHPP will not pay for any service already covered by other insurance. It is important that if you have private insurance, that you also send photocopies of your insurance card, front and back, and to be sure to include the date your private insurance started and the address of your private insurer. It is important that we have this information so billing mistakes do not occur. If you ever stop your private insurance, please send us a notice of termination of your insurance so GHPP can remove it from our system. Field 20C is asking which Medicare programs you are enrolled in, if any. Part A, B, C, or D, or any combination. Some people may have the Dual Special Needs Plan, or DSNP, a plan that includes both Medicare and Medi-Cal that requires extra steps to coordinate care with GHPP. If you happen to be on a Dual Special Needs Plan, please handwrite this additional information next to this field or call GHPP after sending in your application to let GHPP know. If you happen to have additional third-party insurance, 21D asks what kind of plan it is, a PPO, HMO, or some other type of coverage. If it's not a PPO or HMO, but rather another plan such as COBRA, an exclusive provider organization, a point of service, a high deductible health plan, or government health coverage through Covered California, check the Other box and please specify this plan in the text box. Field 21H asks if you are participating or would like to participate in the Health Insurance Reimbursement, or HIPAA, program. The HIPAA program reimburses GHPP clients their private or third-party insurance premiums to help alleviate the burden of their healthcare costs. Please note, however, that the HIPAA program only reimburses premiums for the insurance provided through a GHPP client's employer, and then only covers the share of costs for the GHPP client, not the costs of any other family who might be on the plan. If you wish to take advantage of HIPAA, please make sure to indicate on the field 21H. And if approved for GHPP, the team will send you a separate HIPAA application to complete. Please note, HIPAA must be reapplied to every year along with your GHPP renewal. Section C asks for information regarding your sexual orientation and gender identity. Question 24A is mandatory. All other questions in this section are optional to complete. Section D of Part A is the certification section of the application. You must review and initial each statement in the section, sign in the signature box, and date. If you are filling out this application from your computer, you will be digitally signing the document. All computers using up-to-date browsers should give you the ability to digitally sign. If it is your first time digitally signing a PDF document, clicking in the field will produce a pop-up that provides you the option to create a digital signature. Simply follow the instructions. If you still encounter difficulty digitally signing, you can always just print out a hard copy and sign by hand. Keep in mind, unsigned applications will not be processed. Once Part A is filled out, you can scroll down to see instructions for each field. Please review the instructions to make certain you completed the fields in Part A correctly. Part B is necessary for gathering information regarding your income, as there is an enrollment fee for individuals making over 200% of the federal poverty line. How much your enrollment fee is depends on your income. Most specifically, the adjusted gross income reported on your previous year's taxes. Please remember that falsely reporting your income is prohibited and may result in adverse action and disenrollment from the GHPP program. Field 6 asks for your family gross income. This would be the total yearly income you received as reflected on the adjusted gross income on your latest 1040 tax return, whether filing as single or jointly with a spouse. If you are listed as a dependent on another individual's tax forms, that individual's AGI will be needed to be listed instead. If you do not have your latest 1040 tax return to provide, you will need to provide other financial documents that verify the source of your income, such as SSI or disability statements, W-2s, or so on. If you currently receive no income at all and are completely supported by other individuals, such as other family or friends, and are also not listed as a dependent on another's tax returns, then you may include a letter describing your hardship and the source of your support, and this letter must be notarized. The GHPP team will review your letter and determine if your financial hardship warrants a waiver or reduction in fees. If the financial documentation you provide is unclear or incomplete, the GHPP team may request additional supporting income verification. This may result in a delay of your application approval. In Field 8, you are asked to include your family size and list the individuals, including yourself, who are reliant on the same income under which you receive support. Section D should look familiar. This is a certification section of Part B of the application. Again, it is very important that this section is completely initialed, signed, and dated, as was Part A. The following pages will provide additional instructions for completing each field of Part B should you have any difficulty completing. Finally, at the end of the instructions section, you will find directions for submitting your GHPP application. Remember, the entire application, both Part A and Part B, must be completed, initialed, and signed before submitting. In addition, we require copies of other documents you will need to submit along with your application in order to verify and support your eligibility. First, we need a copy of your photo identification, such as a driver's license, passport, or student ID. This needs to be valid and current, not expired. Secondly, we require proof of residence. GHPP clients must physically reside in California and not in another state or country. This proof of residence may come in such forms as, say, a utility bill, lease agreement, or voter registration. The proof should show your name and the same residential address that you listed on your application. P.O. boxes or printed addresses that do not show your name do not count as proof of residence. Thirdly, we require proof of income. As we stated when going over Part A, you must provide documentation that supports the family income you listed in the application. The best document to provide is the latest IRS tax return form 1040, which shows your adjusted gross income, or AGI, from the previous year. Again, in the absence of this form, you may also provide copies of your SSI statement or copies of your W-2s. The clearer and more complete the documentation you provide, the faster we will be able to process your application. And again, if you do not have any income, you may submit a signed, dated, and notarized letter describing your hardship and support. Hardship letters not notarized will not be accepted. Finally, if this is your first time applying to the Genetically Handicapped Persons Program, you will need to provide copies of your medical records showing your GHPP diagnosis and most recent genetic lab test results to support your GHPP eligible condition. Your doctor should be able to easily provide you these documents. Also, if you were previously enrolled in the GHPP program but have been disenrolled for over a year, you will need to resubmit your medical records. Note, the only exception to the requirement to provide additional documentation is if you are already enrolled in a Medi-Cal managed care plan. If you are already enrolled in a Medi-Cal managed care plan, then your eligibility will have already been reviewed by the state and be reflected in our database. In such cases, managed care plan members need only provide us the completed application. Once you have completed your application and made copies of all necessary supporting documentation, you may send it either by email to ghppeligibility@dhcs.ca.gov or send by regular mail to GHPP, Mail Stop 4507, P.O. Box 997413, Sacramento, California 95899-7413. If your application is incomplete, someone from our team will be reaching out to you. If all documentation is in order and the application is filled out correctly, you will be sent an approval letter and nothing further will need to be done. If the GHPP system determines by your income that you will owe an enrollment fee, you will be sent an approval letter titled G41. With an option to pay your enrollment fee in 1 or 3 installments. It is important to return this form to us to update your payment schedule. You will then be sent pre-printed payment slips in which to send your enrollment fee payments. Please be aware, failure to pay or late payment of enrollment fee may result in disenrollment from the program. As of the making of this video, you'll need to renew your GHPP enrollment every year. When you receive your GHPP approval letter, please make note of the start date and mark your calendar for the following year to renew. GHPP will send a renewal application ahead of time, but if you should not receive your renewal application for any reason prior to your program period's expiration date, please download an application from the website once more and send it in. And of course, you may call GHPP at any normal business hour at 916-713-8400 to get help from one of our team members. Thank you for watching.